Welcome to Two Hypnotherapists Talking with me, Denise Mejia, in Delaware, USA.
And me, Martin Ferber, in Preston, UK.
This weekly podcast is for anyone and everyone who'd like to know more about the fascinating subject of hypnosis and the benefits it offers.
I'm a clinical hypnotherapist and psychotherapist.
I'm a retired medical doctor turned consulting hypnotist.
We are Two Hypnotherapists Talking.
So let's get on with the episode.
Okay, so let's get on with the show.
Yeah, absolutely.
Episode 3.
Are you over the inertia from all the Christmas and other holiday celebrations? Are you back in full back?
Yeah, I sort of came back with a bit of a vengeance. I'm rocking and rolling.
All right, good. Glad to hear it.
Do you know what I thought we could talk about today?
Mm-hmm.
Something we've only ever mentioned in passing, but we actually both help a lot of people with it. But we've never talked about it. IBS.
Yeah, but the most frequent reference to it is when we complain that the NHS and various other medical groups say the first line should be hypnosis for IBS, and yet none of them will pay for it.
No, that's right. It's on the NICE website over here.
Mm-hmm.
One of the first choices for IBS should be hypnotherapy.
Very unlikely that people aren't familiar with the acronym, but it is irritable bowel syndrome, and it can be really debilitating. People can be in so much pain they really can't function. So yeah, it is. Okay, it's worth treating.
I before I trained to be a therapist, I thought IBS was just when people needed to go all the time. It can be like a constipation as well, can't it?
Mm-hmm. Yeah, actually, it's usually either or. I mean, you have bouts of strong constipation and then bouts of almost diarrhea where they have so much mucus built up. But let's not go in the medical route. We know that it's a syndrome that some people have and it can be quite debilitating, but it's not cancer. It's not those kinds of things. And hugely influenced by stress, which of course is the bread and butter for all hypnotists who are working clinically, is stress. So a large part of what we would do with them is just to get help.
Yeah, I mean, you've said it on many occasions, haven't you, that any medical condition can be exacerbated by stress.
Yeah, but they could be absolutely fine and dandy, and then have some major stressor, and all of a sudden it raises its head again. So it is not to be confused with things like Crohn's, which are organic illnesses, which also, of course, would be worsened by stress if it's a different disease. So I haven't seen very many people for it. I think perhaps because gastroenterologists may already have people that they refer to because it is so well known in the literature. But I have had a few, and I've had several people ask about it, whether it would be useful for relatives or whatever. How about yourself? Have you seen many?
Yeah, it's one of the things I do actually put on my website that I can help with IBS. Because when I was being taught to be a therapist, I was quite sort of fascinated by all the all the research behind it that's been done on IBS and on hypnotherapy for IBS. And I was sort of really surprised by all these different trials that have been done and by the results from them. But when you think about it, it's like, I put this in layman's terms, obviously, but when we think about something, we can induce various physical reactions within our body, can't we? If you think of something scary, you might start shaking, for example. Right. And of course, when we think of something terrible, we may suddenly get this urge to rush to the loo. It can happen, and I suppose that's, again, because I talk a lot about the primitive brain. Some people refer to it as the emotional brain. But going back to the days when we were running around naked, as it were, if we needed to get away from some kind of threat, maybe we would just sort of evacuate our bowels before we ran, wouldn't we?
It could possibly. Hopefully not a problem now, but yeah, it's been around for millennia. As long as people have had guts, they probably had irritable guts. It does tend to get worse in adolescence, I think. You don't usually see too. I don't think, I'd have to check the statistics, but it tends to be, I think, perhaps because we feel more stressed than any other time. Do you follow a particular protocol?
It's all about the reduction of stress. Everything I do, it's about that, that relaxation, that deep therapeutic relaxation. And again, getting the client focused on more positive things, because when we occupy our mind with positive things, keeping our brains active and things to do, we tend to worry less, don't we?
Mm-hmm.
So again, that that kind of thing, it's actually pretty straightforward. I found it helping people with IBS.
Mm-hmm. I was at the Royal Society in London. They had a speaker on IBS recently. Well, within the last 2 years at least. That's recent for me. I'm old, but he works at Duke University, which is a pretty well-respected institution, and he has a protocol. It's a 12-week protocol.
Okay.
I think it's very uniform. Probably rather like what's that system you use where you ask your clients to score themselves after each session.
Oh, with the corp.
Yeah, I think that's probably why they're so strict about using exact, so they can gather information. We said this to this person. We said this same thing to this person, and how it varies. But there's a huge number of people who suffer from it who would benefit if they knew that hypnosis would help. It doesn't. I rarely get a positive response if you tell somebody it's your nerves, dear. If you're telling them you just need to relax. It's not the way to approach it. And unfortunately, most people have heard that, so they tend to avoid. I'm not well today, and stay hidden away.
Yeah, it's strange when we think about it. If we're going into an acute stressful situation, like a job interview or a driving test or something, yeah, we get this urge to go to the loo, don't we? Or maybe to go and take a wee. Anything nervous?
Yeah. Well, the thing is, if you've got an interview coming up, you usually think about it for quite a while. So it gives you lots of time to get stressed out. Driving test, yeah, probably the same thing. It's a long time since I took my driving test. But
yeah, Denise came out as a closet driver last year after knowing her for a few years. I finally found out she can actually drive.
No, I used to be able to drive. I can't now. But it's all of those kind of anxiety provoked things can be made worse. But this is something we have actual concrete proof that it's a stress response. This would last 2 weeks ago. We were talking about stress signature, and this would be very definitely somebody's stress signature if they started having problems again in that area.
Yeah, I mean,
a lot of the time your stress creeps up on you. You don't even, it's so present in your life, you forget that you're stressed.
Well, I say that. I say that to everybody, that it creeps up on us without us realizing it. Because obviously I talk about that metaphorical stress bucket all the time, and I say it gets filled up, and it can be a gradual process. It may be that we've had a bad year, for example, just one thing after another with no let up.
It's the frog in the pool of water that's gradually getting hotter. You don't realize it until it overflows. And somebody who has a disorder like this would possibly get information ahead of time, but it doesn't really matter why you're stressed. We should reduce it.
But getting back to IBS, though, I mean, it's not just a case of needing the loo, is it?
No, it's serious abdominal pain.
Yeah, very,
very stressful. Yeah, and that in itself, the pain in itself, it's a stressor too. So it's just a vicious cycle.
As with a lot of things that are stress related, it does become a vicious circle, doesn't it? Okay, so you've helped a few people then with IBS. Have the effects been long term?
Yes, I mean sometimes they'll come back and say,
they need a top up.
Can I have another audio, please? Yes, to help. The stress is coming from a different angle, so they're. Most people are stressed by certain kinds of things. And some new thing comes along and they respond slightly differently. But one of my first, remember the first woman who I was seeing, who's very local. She was one of the first people and asked me if it would be useful for that. But she has multiple gastrointestinal issues. She sees a variety of specialists. Actually, I should ask her to refer me to them so I can talk to them. I only had to get permission from one. But it is. I mean, it's very.
Do you know? I think the thing with this is it's like with so many other things. At the end of the day, hypnotherapy is. I say it's a talking therapy, isn't it? Yeah. Okay. So then people will think to themselves, how the hell can you get rid of IBS just by talking?
Yeah, well, you can't. You by relaxing, and you're
Yeah.
relaxing because we're
Yeah.
talking.
No, but I mean,
But
it's a drug-free option, isn't it?
hmm
It's a completely natural process. But it still never ceases to amaze me just how useful hypnotherapy can be, how helpful it can be,
hmm
how beneficial it can be for so many various things. And yet, in its simplest form, it's a talking therapy.
yeah,
Slightly
although
more sophisticated than that, but
well, yeah, but it's really it's allowing you to quiet the little voices in your head that are going on at you, causing all sorts of things. They
just going off at a tangent as I always do for a
please do,
change.
please do.
Just something you just sprang to mind. Then I saw an interesting meme today, and it said, "What names is that voice in your head calling you?"
Oh yes, probably quite a lot. Stupid. Yeah,
No, but that affects us though, doesn't it?
of course.
Yeah.
And in fact, those very same things could be because somebody may have been penalized by a parent if they had those kind of symptoms, or
Mm-hmm.
find it very difficult to work in a job situation because they were constantly having to go to the loo. Those we internalize so much of the not necessarily spoken words. You just see a look flash across somebody's face. All the words you've heard all of your life hit you. It's a trigger, so
Yeah.
it's very difficult.
Yeah. Absolutely.
But it does definitely work, and I think that maybe what we should do is put something in the show notes, another link to
Some of the references,
some of the references.
yeah,
Yeah,
absolutely, yeah,
yeah.
absolutely. I mean, okay, so somebody's got IBS. I mean, it's going to obviously again. I don't have your medical background, but if somebody's had IBS for quite some time, I would imagine all their sort of vital mineral levels and things could be up the wall, couldn't they?
It doesn't usually because it's very intermittent. Um, um, they probably I don't remember if I've and you I didn't do adult medicine. I did adult but only emergency medicine. When I trained, I was a pediatrician, and I don't remember their numbers being funny. Obviously, people with Crohn's disease, it's a little bit different, but I don't. I think a lot of it is people are scared to eat or drink certain things because they think it's going to make it worse. And so you might therefore get into some, oh, I can't eat oranges. You could talk yourself into having problems with some kinds of foods, but it's a very complex interaction, and I think that we'd be treading on medical toes. I think we talked about it much.
You've just said something there about you can talk yourself into letting yourself think that certain foods will affect you. And basically, yeah, you're hypnotizing yourself in a negative way.
Yeah,
Yeah.
yeah.
There you go. There's another way to explain hypnotherapy to people, though, isn't it? Because we talk them into a different mindset, and that in essence is what it is.
We're going to give you the pre-approved words. You pre-approved them yourself when we were talking to you. You can use these words. It's because I think a lot of it is people mistake Crohn's and IBS and diverticulitis, another abdominal pain, difficulty with going to the bathroom or whatever. So, and that is very much food. You've got to be very careful about what you're eating if you have diverticulitis. So IBS doesn't usually go towards anything really terrible, but in itself it is very, very disabling. What I find so strange is think how much money the National Health Service would spend on meds and on frequent visits to the emergency room or the doctors if you're in that much pain by just allowing your patients to have a few sessions with hypnosis. Nuts. It's nuts. When it's so well
although one area health authority, and it escapes my mind which, was advertising recently for registered hypnotherapists.
Oh.
So it looks like they're taking some. I don't know whether it was for
for a particular,
hypnobirthing or for
or for a
IBS or yeah.
for a particular study, perhaps, if they had funding.
No, these were full-time jobs.
Oh, really?
Yeah,
Very nice.
yeah, they were recruiting for full-time hypnotherapists, and I thought, well, finally, maybe things are changing.
Mm-hmm.
I mean,
Not probably.
was
I don't think you'd want to work. Would you want to work for the
no,
NHS? Now
I'm too busy.
you're already out and practicing.
I'm way too busy. But no, this is before you started practicing medicine. CBT, that's been around since the 70s, hasn't it?
Mm-hmm.
I'm just wondering, was there the same kind of skepticism about that when it first
I wouldn't
became
be surprised if they were
popularised?
skeptical. Most people are skeptical, but that you should be seeing a licensed psychologist or psychiatrist. So you're probably already in that environment to go over. And so psychologists may well see you outside the threshold of the NHS, but it's available, although fairly limited sessions. I don't think they pay for very many sessions.
Over here?
Depending on what, yeah.
Yeah, CBT is available on the NHS.
Yeah, but how many sessions do you get?
I think it's only about 6.
That's what I said.
Yeah.
they limit you. Yeah, you can go
Yeah.
back again, but you have to.
Yeah, they're registered, BACP registered CBT therapists over here within the NHS. But yeah, it's about 6 sessions from what I can gather. So you've probably been halfway exposed to whatever it is you need exposing to, and then they stop the therapy.
But now we know that hypnosis is a very rapid, for those people who perform well under hypnosis, and most do. Most of my clients don't need more than 6 sessions. If it's a discrete issue, and some of them have got, and let's fix this, and let's fix that too. And sometimes they want separate sessions for that. But somebody who wants to lose weight or has IBS or those things, you can have a fixed number of visits over a period of time.
Yeah, I mean,
for most of those things.
My average for most things is about 6 sessions.
Yeah,
Yeah, I mean, and weight loss is 6 sessions. Because with the weight loss, they don't need to stay with me until they've reached their desired weight. They're just well on the way and everything's fine.
Right. But I think with things like IBS, a lot of it is, since we know a lot of it is stress and relaxation, we have audio tapes. Once you understand how to allow yourself to relax in a session, you can do it to yourself.
Absolutely.
So.
Absolutely.
Yeah.
But I'm just thinking again with IBS. Okay, so the de-stressing is a big part of it, how the hypnotherapy works. In terms of perhaps the bloating, the abdominal pain, and the urge to go to the loo and what have you. But also, of course, when your stress levels are lower, your sort of gut flora is in better state, isn't it? Because stress can affect that.
Well, yeah, you're also more likely to eat things that will help it do that. So you're eating more sensibly. I don't know that, I have to look at the protocol again, but I don't know if there's much instruction amongst the academic centres, much instruction they see a dietitian or not as well. Probably would be a good idea.
Well,
If only because they're going to got to work with the backlog of bad bacteria to get to the good stuff.
Let's face it, who can't improve their eating habits? Who doesn't have a little bit of room there?
Yeah, absolutely.
I mean, we do. I mean, when it comes to eating, we indulge, don't we? We see it as a luxury. We get a bit of comfort from it.
Yeah, but I think a lot of people think it's I need this sticky toffee dessert. I've had a bad day. It's not just, and there's no, it's fine to have an indulgence now and again. And it's the same. There was a really good series on PBS with Alan Alda. He was talking about the foods that we have for our festivals and our feasts. We cram all of them on the table. It's just like everything gets on the table. Nobody ever takes something away. This year we're going to have this kind of pie instead of that kind of pie. Let's have this pie too.
Yeah, I mean, there's something about food though that we use it also as Maybe one-upmanship's a bit of a stronger thing, but you go to somebody's house or they come to yours and
Oh
you
yeah,
put
we've
on
got
the
to show
biggest
off.
spread, yeah.
Yeah.
But also, um, it's seen, you welcome people with food, don't you? Or a drink.
Right. Which is why it's so difficult for people who have digestive issues for whatever reason, IBS being one of them, to feel that they can socialize, which is stressful in itself. You've got to think up another reason you can't go to something or other. There's all those kinds of stressors.
I mean, I say anything that's stress related is self-perpetuating, isn't it?
So
I'm
this-
looking here
this-
when you're talking about putting some references in the show notes. I'm just looking at some simple statistics here. There was a research study done in 2013. 75% of IBS patients receiving hypnotherapy experienced significant symptom improvement
Yep.
and a 60% reduction in gut-related anxiety. Okay.
Interesting they said it that way instead of the anxiety went away.
Yeah, but I'm
did
just thinking.
Did it turn into some other kind of anxiety?
But I'm just thinking when drug trials are done, for example, what do they regard as a successful rate?
Oh, well, they're looking for negatives. If it works for the thing we're dealing with, obviously that it's drug trials.
Percentage wise, though.
Yeah,
so
but you don't get to human trials for a really long time. So quite this is a little less. Certainly, they have to have restrictions, and certainly they have to make sure you don't have anything else going on that might be confusing it. But
yeah, all right. No, I'm just looking at the British Society of Gastroenterology. Okay, their guidelines recommend adding hypnotherapy as a treatment option for IBS patients who haven't responded well to other interventions.
right, but it's now since they wrote that. They're saying start here.
Try that as the first option,
Right.
yeah. But again, see, here's me. I'll get on my soapbox now about our NHS because hypnotherapy may be a more expensive option compared to some drugs or whatever.
In the short term.
Yeah. But I'm saying with our NHS over here, my experience of it is, so this is anecdotal, not a quote. They try the cheapest thing first. If that doesn't work, then they go to the next more expensive thing. They don't start with the good stuff. They'll start with the cheapest option.
Well, yeah, it depends on what it is you're looking at. I mean, if we think you're having a heart attack, we'll put you in the heart attack section of the hospital first.
Yeah.
And when we realize you haven't got it, we'll take you out, not the other way.
I knew you'd jump to their defence.
Yeah, well, doctors are trained to look at what catastrophic thing can happen, but you go through that log really fast to decide how you, and nothing is foolproof.
Okay,
So it can always be somebody who's going to be an outlier and now having something else that's catastrophic happening, and this is just a red herring that we're looking at now.
yeah, so we're talking about somebody coming with abdominal pain then. You'd soon suss out if it was their appendix, wouldn't you?
Right. Particularly if it's already missing. But yeah, that's it. But most IBS is usually something that's come on more or less gradually, and it's a diagnosis, rule out, and then once they've you've decided they haven't got appendicitis, they haven't got this, they haven't got that, and they're dealing with this over several weeks or months, then you aren't going to have to go and reinvent the wheel. But you do have to be careful, because if they have still got an appendix, they could still get appendicitis.
Yeah.
But if the pain that they're having is exactly the same as it was yesterday, and that obviously new symptoms still have to be reevaluated.
Can appendix play up at any age, Denise?
Yeah.
Yeah, I always think of it as children with appendicitis.
Yeah, it's usually 7 up thing.
I just remember one year in secondary school, there was about 6 different people in my one class that all had their appendix out in the same year.
The youngest I've seen is usually just shy of 2. It's really young. But and again, you don't expect people to be 80 suddenly have appendicitis. It can happen.
Can it? That's what I'm saying. Can it happen? Yeah. All right. I had no idea. I always think of it as
you thought you were free, huh? No.
Yeah. So, I mean, if you think about it, then somebody who's got IBS, okay, there's the obvious inconvenience of it, etc. But if hypnotherapy, if they were to have hypnotherapy and it helped them, apart from the obvious thing that it would help with, it's everything else, though, isn't it, as well? I mean, it would give them the freedom back.
Right. Bladder urgency. You don't want to get on a train for 3 hours. You don't want to do this. You don't want to do that. You know, it could come on at any time. So it is very restricting.
Yeah, it is. I mean, it could literally give somebody their life back, couldn't it? If that's not too big a statement to make. But yeah, that is the thing though, isn't it? With IBS, it is really debilitating. Yeah. All right, well, we're almost at the end of the episode, Denise, and we waffled on as usual. But
isn't that a relief to everybody listening here?
It would be good, though, to talk about IBS, because it is one of those things that hypnotherapy really helps with. So if that's something, and again, it's one of those things that people get reluctant to talk about. You know, I don't know how it is in America, but over here, you know, we go to our doctor, we don't like to talk about our bowel movements or other kinds of things in delicate areas.
And yet they're all over the advertising here.
Really?
Yeah. But yes, people will not volunteer that information usually, which is fine, but you should volunteer it to your doctor. You should tell your doctor what's the problem.
And once your doctor checked you out and told you it's IBS, come and see us.
Preferably with your doctor's blessing already, instead of us having to backtrack and get it.
All right, so we'll put that information in the show notes as well.
Yep.
On that research, because it makes really interesting reading. We'll catch everybody on the next one.
Yes, hopefully we will have a guest by then. We hope you've enjoyed listening. Please remember, this podcast is designed to give you an insight into therapeutic hypnosis and is for educational purposes only. So remember, consult with your own healthcare professional if you think something you've heard may apply to you or a loved one.
If you found this episode useful, you can apply for free continuing professional development or CME credits using the link provided in the show notes. Feel free to contact either of us through the links in the show notes. Join us again next week.